Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, and welcome to the Bee's Knees podcast. This is PJ Ewing, your host, and you're right at the beginning of a 7-day, 1-week-long kind of cool little thing. I've got different experts in their fields with different insights on different aspects of recovery that I'm going to share with you. Each podcast episode is very short, including this one. And you're going to have a quick little burst of insight from a physical therapist, a pathologist, a PTA, someone with real expertise in their field about knee recovery. And then you'll be off to the next one. So without any further comment about this series, let me get right into the first episode, this one, of this week-long series, and that is featuring Lisa Alarcon, a physical therapist in Michigan. She's got all kinds of great credentials that you can learn about when you visit the episode web page. But in this case, she talks about scar tissue, the formation of scar tissue, some really great examples of how to think about scar tissue and what you can do to avoid it or deal with it if it seems to be becoming a problem. So this is Lisa Alarcon describing fibrosis and scar tissue for you.
Fibrosis is another way to look at scar tissue. It's scar tissue plus. Okay, some of the scar tissue that we have, you can kind of think of like spiderwebs, right? And so we can move the knee joint a little bit or the shoulder or whatever joint it happens to be, and we can break those spider webs and we can get some range of motion back. Fibrosis is more like duct taping the joint. Okay, so now you have a good amount of scar tissue that has set up in that. And so when that happens, also the components that make up something that's fibrotic versus something that's strict scar tissue is they're a little bit more intense. They're stronger, their tensile strength is stronger, they're thicker. So fibrosis compared to kind of what I would consider normal scar tissue is just really kind of scar tissue on steroids. And it's a lot harder to break through. Usually those are the people that need the manipulations because they've had that fibrotic tissue start to set in. And so that's the difference really between kind of general scar tissue and something that's gone fibrotic. The why of fibrosis has a few different components that back it up. The when is based on the patient. The less I move, the sooner it happens. If genetically I'm prone to scarring, the sooner it happens, the bigger it happens. You can look at how you scar when you cut your finger, and how your body responds to that is a pretty good clue of what's going to happen on the inside. We've seen people that have those really big, bumpy, kind of gnarly looking scars. Those patients are more likely to have that same kind of body response on the inside. And so the when of the fibrosis depends on genetics. It depends on how long you want to sit still for. It depends on things like, I had a knee replacement and then I had an infection and then I had another knee replacement. And so if you have all of these other things that come with it that limit your ability to move that joint, you're going to get that fibrosis a lot faster. And so the when and the why kind of combine and based on genetics and kind of extenuating circumstances, but certainly the less you move the knee, the less frequently you move the knee, the more likely you are to build in that kind of block. And it really feels like a block when you get patients that have that. It's not as springy as you get when you kind of push them as it is when you get just a general scar tissue. I think X10 helps prevent scar tissue in general, right? If we can prevent general scar tissue, we certainly can prevent scar tissue on steroids when you talk about something like a fibrosis, because you get in and you get moving early.
Okay, that's it. A short and sweet podcast on a very important topic. Keep listening, keep sharing, keep commenting. All your feedback is welcome. You can reach us at thebesneyspodcast@gmail.com. You can see a lot more great content at x10therapy.com. You can /blog or just look up any of the topics that you're interested in. We've got a wealth of content there. There are a number of private Facebook groups online that we support as well. So there's a whole dialogue going on that you can learn about when you get to the website. Thanks for listening. I'll see you next time.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.